Welcome to the Voices Conference Panel, Health Equity Outlook 2022. Um, this panel will discuss what 2021 has brought with the winds of change to the health policy arena. Over the past year, momentum has been building for the introduction of various legislation that aim to improve health equity to greater access to healthcare, including for immigrants. However, longstanding challenges to health equity remain, especially with regard to COVID-19 and its impact on the Asian American, Native Hawaiian, and Pacific Islander communities. We will hear from health policy advocates about lessons learned in the first 100 days of the Biden Harris administration and strategies for advancing policy initiatives for better health equity in 2022 and beyond. My name is Aziza Ahmed, and I am the Policy and Community Advocacy Manager at the Asian and Pacific Islander American Health Forum. I'm privileged to be the moderator for today for this esteemed panel. Joining us on the panel, we have Soyoung Chamorro. Soyoung is a first-generation immigrant working mom who is passionate about building power to create change so her daughter can live in a more just world than the one she inherited. Soyoung leads NAPOF as executive director with a vision of building power with Asian American, Native Hawaiian, Pacific Islander women and girls. NAPOF is a leader in advocating for immigrant rights, economic justice, and reproductive right and health while using the reproductive justice framework. We also have Tavai Sumelu. Tavai is the Executive Director of Empowering Pacific Islander Communities, also known as EPIC. She's a passionate advocate for Pacific Islanders and is committed to liberation for all. Tavai was born and raised in Tongva land and credits her time on unceded Ohlone territory for her political consciousness and identity. Before EPIC, Tobias served as the development director for the RISE Youth Center in Richmond and has since become a member of RISE's board of directors. The pandemic has taught her the most important title is Auntie Vi. My title as Auntie Zizi is my claim as well. We also have Nisha Ramachandran. She serves as the executive director of the Congressional Asian Pacific American Caucus. Nisha joins CAPAC with nearly a decade of experience within the national Asian American and Pacific Islander community. She most recently managed her own consulting business, specializing in community engagement, government relations, and strategic advocacy for AA and NHPI organizations. Prior to that, she served as a policy director for the National Council of Asian Pacific Americans and was the Apex Fellow. Nisha cannot join us today, but prepared some remarks for you all today.
Hi, I'm Nisha Ramachandran, the Executive Director of the Congressional Asian Pacific American Caucus, or what we call CAPAC. I'm thrilled to be joining our longstanding partner, the Asian and Pacific Islander American Health Forum, for this important discussion on health equity. From the health impacts of COVID-19 to the rise in anti-Asian hate that we faced and the economic hardships we've endured through this pandemic, 2021 has been an incredibly difficult year for our Asian American, Native Hawaiian, and Pacific Islander communities. And that's exactly why health equity is so important. Despite gaps in disaggregated data, we know that various health issues affect different communities in disparate and often disproportionate ways. For example, APIs make up 6% of the total US population, but account for over 50% of those living with hepatitis B. And we know that when we get into the data, we see even more disparate and disproportionate effects on different parts of our communities. Finally, we also know that despite COVID-19 ravaging our communities, so much is missing in terms of the data to show the virus's effects on the specific sections of the AANHPI community. And we cannot talk about this past year without mentioning the anti-Asian hate that our communities have been facing. In fact, from March 2020 through June 2021, more than 9,000 hate incidents had been reported. CAPAC members Senator Mazie Hirono and Congresswoman Grace Meng's COVID-19 Hate Crimes Act, which was passed with bipartisan support in Congress and signed into law by President Biden, is such an important step that we took this year. CAPAC is working closely with the Department of Justice and the Department of Health and Human Services to continue making progress on implementation of this law. And speaking of HHS, just a few weeks ago, CAPAC members met with Secretary Javier Becerra, where they discussed some of the most pressing issues related to health equity for our communities, including data disaggregation and language access, since we know that 1/3 of our API communities are limited English proficient. We're working closely with HHS and others in the Biden administration on these issues. As we near the end of this year, Congress is working to pass the Build Back Better Act, a bill that makes transformational investments in our communities, including on paid leave, affordable quality childcare, housing and rental assistance, caregiving, and other programs to help expand healthcare coverage to more of our communities. Now let's also take a quick look ahead to 2022. CAPAC, in conjunction with the Congressional Black Caucus and Congressional Hispanic Caucus, are together known as the Tri-Caucus. Every Congress, we work together on the Health Equity and Accountability Act, or what we call HEA, to address health equity issues across communities of color. Each Congress, one of the caucuses takes the lead. So as we move into the coming year, we'll be working closely with our Tri-Caucus partners, this year led by the CBC, to take the lead and ensure that health equity priorities of communities of color, and for us, especially AANHPI communities, are included. I want to thank the Health Forum as well for your long-standing work on this bill as one of our community stakeholders' voices. I'll wrap up by thanking all of you for joining us today. Your work and advocacy on health equity issues are so important to moving these conversations forward. I've worked with Health Forum for many years, and I thank you for your long-standing leadership on these issues that are just crucially important to the health of AANHPI communities all across the nation. I hope you will continue to be engaged in advocating for our community's needs, both within the administration and within our partners in Congress and with us here at CAPAC. Thank you again to the Health Forum for inviting me to participate. I look forward to our continued partnership to bolster the health equity of our communities. Thank you.
Thank you, Nisha. As Nisha mentioned, there were several notable steps that the Biden-Harris administration achieved during their first 100 days, as well as progress in the Hill in regards to things like the COVID-19 Hate Crimes Act. For your individual organizations, what major hitways or notable steps have you seen happen on the Hill or with the Biden-Harris administration so far in terms of health equity? Tafai, I'll start with you.
Thank you for that. I think it's important to acknowledge that the initial narrative early on was the idea that anything would be better than the previous administration, and also acknowledging how much of the first 100 days was really spent on doing so much of the harm and damage caused by the previous administration to our communities. I also think that when it comes to, and specifically speaking for NHPIs, it felt like a bit of a missed opportunity to not have NHPI representation on the COVID Equity Task Force. But what should be applauded is the ways that data disaggregation has been a key priority in the report that was recently released in the recommendations, that it was understood why that was a critical issue, and the absence of data disaggregation would only lead to further inequity. I think the other component to celebrate and lift up is as a way in which health equity, we're a little bit closer to it, is the housing of the White House initiative on AANHPI in HHS, and what a critical position that is for our communities to have in bridging the gap and having direct access to the agencies who are leading so many of the decisions on the distribution of resources and what it looks like to properly serve our community, and actualizing change through health policy. I think the last component that I really want to celebrate is the naming of Crystal Ka'ai as the executive director of the White House initiative on AANHPI. She is the first NHPI to serve in that position, and really represents from her own identities and upbringing someone who's been imbued and born into the inequities and barriers that Native Hawaiians and Pacific Islanders often face, and has lived experience around meeting that, and how in that representation, how many NHPIs feel seen and understood and feel hopeful about what can be achieved.
Thank you, Tafai. I hear you. It's great to have a friend and an NHPI leader right, in the administration, and we look forward to more. So yeah, I turn to you now. Same question. What are some of the notable steps and headways for your organization with this new administration?
Yeah, so I mean, Tawai's named a couple that I was gonna say too, but I just want to highlight um, both appointment of Crystal and Erica Mortzagu, and other Asian American women in prominent leadership roles in the administration. Obviously, we had all been wanting an appointment at the cabinet level, but I think having Erica at the White House and really an effort for I feel like there is a genuine effort to really understand and hear our community and what our priorities are. And again, like agreeing by that, like so much of what they've had to do is just like undoing or just stopping like the damage that's ongoing. And I, just having had some interaction with the staffers that work there, like it's an enormous task, like, oh, just like reverse these things, it actually is a lot more work and complicated, and I think just takes time than I even ever imagined. So I just want to recognize that, even though it doesn't feel like a big win and big forward step, that it is really setting that needs to be done. I just want to highlight a couple of things that I think, in addition, that I think are good positive steps forward. The White House actually created, Biden administration created a office in the White House called the Gender Policy Council, and really what the purpose of council is to really integrate gender integrate gender perspectives in all of their work, right? And so they recently released a national gender policy strategy, which is a first ever whole of government strategy to address gender equity and equality in the United States. It provides federal agency with a roadmap and framework on gender equity. And this includes a number of recommendations that NAPOF has been encouraging the White House to adopt, such as taking an intersectional approach, right? That we can't solve just one problem and act like that happens in a silo, right? When we talk about COVID, there's economic, there's safety, there's gender-based violence. There's so many components to it that we want them to take an intersectional approach. We need to remove certain barriers for immigrants to access health care, including those in detention, advance language access rights, closing the gender and racial wage gap, and increasing support for culturally specific community-based support for survivors of gender-based violence, and further disaggregation of government data. These are all recommendations or items that are in the outlined in gender policy strategy that we think are really strong and set a good pathway to some really good results from the various agencies in the government. And then there's the president's Build Back Better Act, which include a number of investment that will advance health equity for AANHPI communities. Many of you know that's still in a limbo, and there's a lot of negotiations happening, but I think the original plan that was proposed was really promising and would have done a lot for our community. And some of the things that are still in there are making healthcare more affordable for more than 4 million uninsured individuals, 12 months of postpartum care through Medicaid, which will reduce maternal mortality for Medicaid beneficiaries. And currently, nearly 16% of non-elderly AAPI women rely on Medicaid. So this is, it'll make a big difference for our community. And if we look even further into disaggregated data, over 60% of Bhutanese American women and more than 40% of Hmong and Bangladeshi American women are relying on Medicaid. So clearly it have a huge impact for us.
Thank you. Your statement sort of segues us into the next question, because not only do we talk about some of the successes, but the things that we're still working on. So my next question is, what do you see currently as the biggest challenges or barriers to achieving health equity in AA and NHPI communities in the immediate future? So Tavai, we'll start with you.
Yeah, I mean, this might be a trauma response, but everything looks like a challenge right now. I think what feels most relevant in this current moment is recognizing that although much of the country has decided to move on, that we are still very much in a pandemic that since the onset has demonstrated that NHPI have the highest rates of COVID infection. That was true when race and ethnicity data was first released in April 2020. And over a year later, it still remains true. And so I think the challenge that we are facing is that NHPIs have been tasked with the double duty of both recovery and surviving an ongoing pandemic. Also wanting to make sure that the ways that were resourced, that the ad hoc infrastructure that was stood up to do the rapid response work, as we were the critical trusted messengers, the experts on the ground, that resourcing is sustained. And then also wanting to ensure that models that are stood up are framed around our strength and our resilience as a community, as we've seen that even when armed with data, there was still the onus was still placed on our communities to demonstrate our significance, right? And so that what does it mean to constantly have to operate in frameworks that only pay attention to your suffering, that often pit us in spaces that would be adversarial, as opposed to understanding that we have the expertise to really save our communities, and that as the most impacted, that we want to make sure we're building systems, responses for the most vulnerable, that we're also building systems that will work for everyone. And so I think that's the continued challenge. And we'll probably talk more throughout the panel, as we'll be bringing up data disaggregation as well.
And Sonia, what was some of the challenges that faced your organization, and some of the biggest challenges or barriers in achieving health equity for AANHPI communities that you see as an executive director at NAPAF?
I think for our community, especially for women, it is the top two issues are language access and then culturally competent care, right? I think often we think about healthcare as just like a technical thing, but actually, it's a very personal experience to be seeking medical care. And I think that our country does a very poor job of understanding how people need to be treated holistically, not just like for the medical symptom or issue that they're having. And so, language access is a huge barrier, but also having people who are not culturally competent in providing the care can also be another really big barrier. And then the third is immigration status, right? We are, we live in a country where literally, like, some people cannot get health insurance or afford health insurance because of their immigration status. And in fact, NAPAF is partnering with organizations like the Health Forum on something called the Heal for Immigrant Families Act. And essentially, it would remove barriers, legal and policy barriers to healthcare coverage for immigrant communities. It's to remove the 5-year bar for green card holders to be able to access healthcare, to access Medicaid and Children's Health Insurance Plan, CHIP. Which right now, if you immigrate to this country, one of the barriers is even if income-wise you qualify for those benefits, there is a 5-year bar that you cannot be beneficiaries of those programs for the first 5 years. So it's a huge barrier for not only accessing healthcare, but for families being reunited. If you can't afford to pay for medical care for your family, it's not possible. I guess it is possible, but it is, you're taking a risk, right? Bringing your family members over. This act will also extend Aca Marketplace Subsidies to all persons who qualify based on income, and it would get rid of the immigration status, right? So right now, if you don't have the right documents, then you cannot even buy on the exchange. But this would allow for all people to buy on the marketplace. And they would ensure that public and affordable healthcare covers DACA recipients as well. And so I think being able to remove barriers based on immigration status is a huge piece of what we need to work on. And so we encourage all of you to get involved. You can reach out to the Health Forum, as they're a big partner with us in trying to move this bill in Congress. And I think it would be a huge benefit to all of the immigrant communities, especially the Asian American Pacific Islander communities.
Yes, and we are excited to follow NOPOP's lead in moving HEAL forward. I wanted to turn back to what Tavai mentioned regarding COVID-19 data for the NHPI community. So available data show that, again, available data when it is available on NHPI community show that NHPIs are the most impacted community in regards to COVID-19. NHPI communities have the highest rate of COVID infection as well as deaths amongst all races and ethnicities. I wanted to know, what were some of the challenges in preventing the spread of COVID-19 or accessing care for NHPI communities, and how did organizations like EPIC respond to that?
Yeah, the devastation that COVID-19 caused in the NHPI community was an inevitability of a long-standing health disparities and underinvestment in NHPIs. When it happened, it wasn't a surprise, and I think even before the data was released, what we heard and understood on the ground as community members, like before they showed us numbers, we were attending the funerals already. I think the other piece that I really contend with is that we have no distance from this issue, that we lost elders and leaders while fighting COVID-19. My own family got COVID, the entire household. And so even thinking about what the narrative was early on, and so in some spaces continued to be, was this notion that NHPIs had COVID because of comorbidities, NHPIs. And so even this propagation of a narrative that our communities are at fault, that it's our own cultures that are a deficit as opposed to an asset. And I think what the distinction was when NHPI leaders really answered the call and led. And some of the irony as well is that how many people were holding up and applauding New Zealand and Aotearoa, places that are PI. These are Pacific Islander nations, though occupied and colonized, that those are actually Pacific Islander places, and that when looking for ways to ameliorate and address the needs of our community, we looked at each other, right? That we didn't look at existing US models that often left a gap, but we did see, right, that even the positing of our community's mistrust of government. Well, I'm not going to gaslight my people as if we don't have a long history of being mistreated, as if this country isn't built on the genocide and death of our communities, right? And so even when we proposed solution, it was not proposing a solution and saying, hey, go trust this system that has a tradition of mistreating you. That we said, trust us as leaders, because whatever we risk, that this is what keeps us up at night. The idea that you might not survive. I think the other component in lifting up and thinking about is we understood culture as an asset, from translating and interpreting materials, from dictating the messaging, that we knew that our messaging had to honor elders, faith leaders, that it had to be in language. And I think this also harkens back to the point that Young was lifting up around language access. So I think there's often a misunderstanding when it comes to the NHPI community that a framework of language justice is actually far more fitting, right? That as a community that is both Indigenous and immigrant, that we have communities that are both in points of language revitalization and also in points of needing English language. And so a language justice also understands that, like, English is not the goal. Understanding engagement is the goal. And that when people are already feeling most vulnerable, what does it mean to speak to them in the language of their family, of their ancestors, of their elders? I also think there are places where we understood, even as people were deploying health place indexes or things that really prioritize place-based solutions, that we were population-based, knowing that we are people, we don't have any ethnic enclaves in most places, that we're geographically dispersed, especially in places like California that have the largest NHPI population on the continent. And so our solutions really thought about not just where people live, but where people live, work, study, and worship. Knowing not just what would be most convenient, that our folks are actually going to inconvenience themselves to receive care where they trust it the most. And also knowing that our people are constantly crossing county lines in order to receive services, even so much as people going to different states in order to process their immigration. And so how do we prioritize what people are telling us constantly about how they like to be seen, how they like to be served, and then hoping, and I think maybe this is actually the highest point of hope, is the critical mass of Pacific Islander leaders who answered the call, and now feeling like there's an infrastructure that was stood up that should be sustained, and that people are really thinking critically of like, how do we prevent this from ever happening again? How do we make sure that our communities are always put in a position to be healthy and thriving?
I always have these empowering words. And as a person who identify as Indigenous myself, a lot of what you mentioned resonates with me personally. So I really thank you for your words and the work that so many NHPI leaders stepped up when there was no other resources available and made those resources available for the NHPI community. So turning to other unique challenges in the AA and NHPI community was, and what the pandemic brought was this rise in anti-Asian hate and violence. We saw the mass shootings in Georgia and in Indiana, and also the attacks on our some of the most vulnerable in our community. And this was broadcasted in the media and was hard to see. I wanted to ask you, what are some of the implications on AA and HPI women?
Yeah, so it's been quite a year for all of us. I think that, I mean, that's, I mean, it's an understatement. I've just talked to so many Asian American women who've really said, you know, it's actually even beyond COVID, right? Like what happened in Atlanta was really about this intersection of misogyny and racism in ways that many Asian American women have experienced in this country from the, from 1850s, like in the 1800s when, you know, women coming from East Asia were banned because we were seen to be prostitutes, right? Like that's just how white people in this country have seen Asian women, and many of us have lived experience of being treated that way on the streets, of being hypersexualized. And I think what happened in Atlanta really went to the core of that, even more so than what's happening with COVID. Not that it's less important or more important, but I just think they are kind of two separate issues. So I just wanted to name that. But as it's related to COVID, I think it's a pretty stark picture, right? So women account for 2/3 of folks who work in low-wage workforce, and low-wage work, and this is defined as 40 lowest paying jobs in the country, right? So of the 40 lowest paying jobs in the United States, 2/3 of the people working those jobs are women, and they include Asian American women. And when you look at, and Asian American women are actually, disproportionately represented in that, we make up 7% of the workforce, but we make up 9% of the lowest wage workers, right? So again, the disproportionality of where we're showing up in the workforce. And, what's further exacerbated by the pandemic is that almost half of all AAPI women who experience job losses during COVID have been out of work for more than 6 months. Asian American Pacific Islander have the highest long-term unemployment rate of any other racial group, which is pretty astounding to me. And, when I started getting calls about, why is this number so big? And, many reporters were making the assumption that, oh, is it because Asian Americans, are dual income household and, moms are quitting their jobs to help their kids with virtual school. And I was like, maybe some people, but like, I'm actually thinking, think about it. Like when you go eat out at a Chinese restaurant, like who's serving you food? When you go get your nails done, who's doing your nails? Like Asian American women have been in the service sector for a very long time, but completely invisible, right? And when I start telling those examples, people are like, oh my gosh, you're right. Like including Asian reporters, right? Like we don't even see our own aunties and community members in these in this work sector that's become so vulnerable because of the pandemic. And then on top of that, we learned through a polling that NAPAF conducted earlier this year that 78% of AAPI women have been affected by anti-Asian racism in the past 2 years. And more than half had personally encountered specific incidents of racism. And we know that through the research that Stop AAPI Hate has done, that Asian American women are 2 times more likely to be harassed or to be harassed or experience some sort of racial discrimination incident in public, directed at that by a stranger, right? And so not only are we losing our jobs and feeling economically precarious, but we don't feel safe going out in public, like literally walking out of my house. I have to think about these things, worrying about whether someone's gonna throw rocks at me or yell some racial slur at me, or all of the things that's happened to me in the last couple of years, and know of many more stories of Asian American women who have experienced this. And we know that firsthand sexual violence, sexism, and racism is intertwined for AAPI women. And when I talk to our partner organization EDs who work specifically in the domestic violence and gender-based violence field, they're seeing abuse and violence at frequency and sort of the intensity at rates that they haven't seen before, right? I mean, it is really precarious time for AAPI women, and I think we need to recognize both like what's happening to us in interaction with the broader society in the United States, but also within our own immigrant communities, what's happening to women. And we need to keep in mind that people who are the least likely to seek help due to their socioeconomic status, language barriers, and immigrant status, right? These are folks there are so many people who are coming out to seek help and report things, but there are a lot more people that are not, right? There are so many more stories that are going untold, and so many more people's experience who live day to day really precariously that we know nothing about. And so I think these are really important things to highlight about what's happening with AAPI women, in the context of the pandemic right now.
So it was hard to hear that, almost nearly 80% of Asian American women have experienced some sort of bias. And it's only been, and that's, I would say, as you said, So Young, it's a underestimate of what's been reported. I wanted to combine one of the questions that I had, or two of the questions I had for Tavai, just because we're getting close to the end of time. I wish I had all the time in the world to have for you all. But for Tavai, we mentioned disaggregated data, a lot in this panel, especially disaggregate data for NHPI communities and how hard it is to come by these days, or actually always. And we've been trying to change that a lot. So what does disaggregate data mean for specifically NHPI communities, and how has EPIC and other coalitions that are part of this NHPI coalition that built the policy platform blueprint for NHPIs? What does it mean to have data disaggregation? How can it affect your community?
Yeah, I mean, I think data disaggregation feels like a 30-year-old conversation that is brand new in some spaces, and in other spaces, I feel like I don't know what new thing there is to say. I do want to acknowledge and name, though, that when data disaggregation is deployed, it means different things in different spaces. That here on the continent, data disaggregation is about the disaggregation between Asian American and NHPI. Then in Hawaii and other spaces, the disaggregation is also between NH and PI. And there's also this fundamental question about the purpose of data. What does data actually seek to do? And recognizing that data in all its intents and purposes is not neutral, that objectivity is often a myth, and that, you know, at its best, data can seek to adequately measure a problem, the efficacy of a solution, and also really like knowing too that data can't stand alone. That in addition to the disaggregation of data, that those numbers on a paper are only contextualized by our community experiences. That even when we've seen data aggregation, we've seen its shortcomings when, as an example, and this is a shout out to the Inland Empire PI COVID response team, who partnered with Riverside County and Santa Bernardino County Public Health, who had initially been reporting a vaccination rate of 109% for the NHPI community, right? Which we knew was impossible. We had our own household members who weren't vaccinated. So there's a course correction around it of being like, okay, you all are telling us that we're perfectly taken care of, but we know from personal experience that our communities are not covered. And so recognizing that data disaggregation and data in and of itself can only go so far. And that the question around disaggregation is also an effort to be seen, to be heard, that oftentimes we know what gets masked in the aggregation of things, but also that data disaggregation is this effort at adequately measuring our distance from equity, and recognizing how often we're actually really put in positions to measure our proximity to whiteness. And so how does data in and of itself, data and policy together, become a tool for really uplifting our communities and getting us closer to our efforts at health equity, and also knowing that health doesn't occur in a silo, right? That health and immigration and education and gender and all of these things all are a confluence of all of the ways that our people are able to navigate systems. And the proximity, you know, we know that the further people are from dominant narratives, the more these systems are not created for them. And so the other piece around data disaggregation is, how do we place the inquiry on systems and not individuals? How do we understand that the systems are at fault and the situation that our communities are in are by design? And so even with the policy blueprint that you referenced, you know, that was created, and I also to name that it predates my tenure at EPIC. So many of my predecessors should give credit for that, because it was released in 2012. And what is to be noted that nearly 10 years later, some of those conditions have gotten worse, that have been exacerbated by the pandemic. And the other piece is to recognize the evolution that EPIC has gone through politically and noticing the gaps. I also want to shout out Utopia and the work that they've done to really center, uplift the leadership of queer and trans Pacific Islanders, or cutie pies, and the lack of the uplifting of cutie pies in that policy platform is a huge gap. And also recognizing too that when we map the impact of formal or informal relationships between the US and our ancestral lands, and how often that dictates not only a racial construction, but our ability to survive here, in the US, that we also know that there are certain communities that who should be centered, in particular thinking about our COFA migrant siblings and what it means to honor and have them lead. And so I think that's the point of where we're sitting at. And then also what's been really great and healthy about this partnership with NAPOF and groups like AAPI Women Lead, who have allowed EPIC this space to really grow in our gender justice work, and lift that up as a critical point of access, and can be a leading place to understand how to get closer to health equity.
Thank you. Tafai, you mentioned gender justice and working with NAPOF, and I wanted to ask Soyun a question about everything that's happening as we speak with reproductive justice and access to abortion, as we see in the news every day, particularly within states like Texas and Mississippi. So what does it mean for AA and NHMI communities that these rollbacks are happening, and what do the pending lawsuit mean for legal precedents like Roe versus Wade?
Yeah, I don't want to get into like the specific details of it because it's late in the afternoon and I don't want to put people to sleep. But I think just in big picture wise, what I want to say is that so in the polling that we did, that showed that almost 80% of Asian American women, Pacific Islander women, have experienced racism in the last 2 years. The same group of women, over 80% said that they support abortion access. In some shape or form, right? And so I think one of the biggest gaps there are is how silent the community is in terms of like our community speaking up about the issue of abortion access for our communities. It's not something we talk about often, and often NAPOF is sort of as seen as like the go-to organization that's going to make a statement on abortion issues and the like. But when we have 80% of Asian American women saying that this issue, Asian American Pacific Islander women saying this issue matters to them and that they agree on the fact that we should have abortion access, I think all of us need to sort of take stock about like, how are we, how is that reflected in how we do our work, especially if you're working on health access as an organization, right? So I'm really proud to say that, Health Forum has partnered with us on issues of reproductive rights, for many years, and as one of the, has signed on to an amicus brief that we did file for for the Mississippi case. But I think for me, it's really about when we have these, these bans and control over women's bodies, the people that it hurts the most are the people that are already the most vulnerable, right? It's not the wealthy, middle class, well-educated people who have access to hop on a plane, go to another state or go to Canada to get their abortion. It's the people, it's the folks who are working low wage jobs or who have no support, who have no family, who are stuck, that really are impacted the most. And that includes AANHPI community members. And so I think for me, it's really about the broader impact of already, the issue of abortion access being a topic that we don't openly discuss. It's not a dinner table discussion, right, in our communities. And there's so much stigma around talking about sex and anything related to reproduction, that it makes it pretty difficult for women who don't have the right social networks and support to make choices that's right for them, right? If these laws go into effect and make access even more difficult. I mean, I will say that access is already very difficult because of, again, going back to my original point about linguistic and culturally competent care, right? Like that includes reproductive health care, whether it's going to see a gynecologist or going to abortion clinic. Most of these places do not provide culturally and linguistically competent care. And so as it is, the barrier is already there. And now it's going to become harder because, like in Texas, you cannot seek abortion like some people won't even know they're pregnant, right? By the time like where the ban is in place. And so it's really, again, going back to how do we make sure that most vulnerable in our community have access to healthcare, and that should include reproductive healthcare. Reproductive health care is not something separate. It's not political, as if other healthcare issues are not. It is healthcare, right? And to say that reproductive healthcare does not fall into the category of public health or health access, is really not taking a gender justice approach to health equity. And I think that's something that we need to be all thinking about. Like, how are we incorporating reproductive health care and its access in the full spectrum, right? Like, including like maternal health and fertility issues, like all of it, right? Like, how do we include that in our health access policy work and community work, right? That healthcare isn't just about like the things that all genders can access, but there are like things that certain genders can't have more barriers to, that we need to pay attention to. And I think that that's much needed, especially as the trend shows that we're going to see more restrictions, more bans like the Texas ban happening across the various states. We really need to be much more bold and intentional about including reproductive health advocacy, reproductive health access as a priority when we talk about health equity.
Thank you. I look forward to working with NAPAF and EPIC as well to broaden the conversation on reproductive health, make it less of a taboo conversation in our community, so that our voices are heard in the wider and more mainstream, and we can finally better advocate for our communities once they get over the sort of tabooness of talking about reproductive health. So we're running out of time. I have one last question for the panelists, and a quick 30-second each for each panelist. So for 2022, what policy changes do you want to see? So Tavai, we'll start with you.
Yeah, I mean, since I only have 3 seconds, I do want to encourage folks, since there is an entire NHPI panel that's going to be happening after this. So whatever you feel like I missed, there will be other NHPI advocates present who can fill in the gaps. I think there's a lot that I want to see, and I will say that what I've been keeping an eye on that often feels like it's is wanting to actually see more cross-sector and cross-racial policies that are put forth. In particular, it's been heartening. I know oftentimes folks are sort of have placed AANHPI in a particular place, but what I've been watching and feeling hopeful about is actually the leadership of Secretary Deb Haaland and all of the work that she's done for Native communities, and recognizing the ways that anti-indigeneity has been fundamental, like has actually facilitated much of the institutional and historical racism that PIs face. And so wanting that to be something that we pay close attention to, understanding that we have to be pro-Indigenous in our approaches. I'm also looking at the boldness of the People's Response Act from Representative Cori Bush, and also the Breathe Act, and looking at those things as things that have clearly placed communities and relationship and collective power at the center of how they want to address things. And then I think the last piece of just wanting to see policy that is explicitly anti-racist. I think what happens often in our spaces is that they're race specific. So the minimum shared identity is AAPI or AANHPI, and that an anti-racist policy and approach would understand that the minimum shared value is that we understand that we're all committed to dismantling racism, white supremacy, and anti-Blackness.
So Yun, how about for NAPAF? What do you want to see in 2022?
Everything. I mean, we have a very small window to get a lot done. But, I just want to just name that, we should always end with Tavai, because she always has like the most amazing things to say. But if I just could add on anything more to what Tavai's already said is, I think that we need to address the unbearable burdens that parents, working parents, have been carrying through this pandemic, especially in the PI community as intergenerational households, right? Like there are so many working parents, especially working moms, who are bearing really, really, I mean, unimaginable burdens because of how broken our country is. And so I think it's really important that we fix that. And, I think Build Back Better in its original form was an aspiration to really build an infrastructure support so that all families can thrive. Obviously, that's being whittled down. So I would love to see more of those, as they are promising that some of them will show up piecemeal in 2022, including better work, worker rights protections, paid leave, increase of minimum wage, obviously increase and better access for affordable healthcare, including reproductive healthcare. And so, as we think about working moms who are, juggling kids on Zoom school and working a full-time job and setting appointments for their parents who don't speak English with doctors and making sure that they're not getting attacked on the streets. Like, if I got pregnant again and I wanted the choice to not have this baby right now and I lived in Texas, that is like one more barrier that has been put on me that's limiting my choice and how I can really, manage my life and all the crazy circumstances that has been thrown at me this year, right? And so I want to see the country do better by people that really are bearing the brunt of this pandemic. And doing more to step up and really recognize how broken our country is and how we have failed families so badly, and to prioritize fixing that for all families.
Thank you. I think the Health Forum priorities are aligned with both EPIC and NAPAWF, and we look forward to continue our partnership with both NAPAWF and EPIC in 2022 and beyond. And on behalf of the Health Forum and Apex, I want to thank Tavai, So-Young, and Nisha for sharing their experience, expertise, and perspective with all of us. And I thank you all for joining us today. And please enjoy the rest of the Voices Conference. Thank you. Bye.